kind of take us down the road about where stem cell therapy is going and really get us thinking about what are the opportunities in that arena. Philip, come on up. Welcome, Philip.
Imagine we're not at UCI. We're sitting in a spaceship. Doesn't this room look like a spaceship? We are on the USS Enterprise. And that being said, your spaceship captain has an important announcement.
I'm very concerned about healthcare. The real issue is how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? New procedures and developments that help people to live more productive lives and in so doing move America forward?
Well, Mr. Shatner, the non-invasive, non-intrusive medical devices once seen in Star Trek have now become a reality. So we've all seen Star Trek, or at least Star Wars, correct? And when somebody gets sick on the USS Enterprise, they go to the sick bay. They don't treat them with drugs. You don't get a cortisone injection, and they don't do surgery. They treat you with frequencies of light, laser, pulse electromagnetic fields. Now, we think this is something only for the future, but the future of medicine is here. Here's a picture of Dr. Bones McCoy giving something to Captain Kirk. Maybe they're stem cells, maybe they're not. But stem cells is a natural substance, so we feel it is the future of medicine. So I founded the Laser Med Pain Institute to do exactly that. Heal people with chronic pain, disorder, and disease with non-invasive laser technology to signal the body's own healing innate ability to heal itself through stem cell signaling. You mentioned Thomas Edison earlier. He even quoted, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and the cause and prevention of disease." The problem is, this is not taught in medical school, so where do you get the training? We at the American Academy of Stem Cell Physicians, we treat patients and train doctors how to get their patients out of chronic pain, disease, through these cellular therapies and signaling technologies. So what is a stem cell? Well, by the time you're done today, you will know more about stem cells than your medical doctor. Because how many hours of stem cell biology and therapy did your MD get in medical school? 0, okay? So, stem cell is very easy to understand. We're still flying on that spaceship, and we're looking down at Mother Earth. And that is the top of a fireman's helmet. Yes, a stem cell is a fireman. Let me explain. Let's say that knee is your house. It's on fire. How does a fireman know to go to your house if he's 10 miles away? There's an alarm. There's a signal, smoke signal. Those flames cause the fireman to go throw water in your house, inflammation, the flames are gone. That's how a stem cell works. Let's say that's a bone-on-bone knee or L4-5 disc. When two bones rub together, it causes pain, inflammation, and swelling. That inflammation, the word flame, that heat creates a signal for your stem cell to go, get rid of the pain and inflammation. Then the cartilage stem cell is signaled to go and regrow the meniscus or the disc in your spine. So stem cells, they signal repair your body. And that's how your body heals itself. So we manipulate the signaling process with certain frequencies of lasers. These are all the human cell tissue products available in the market. You've all heard of plate-rich plasma. That's what Kobe Bryant went to Germany for. They take your blood, spin it, put it back in you. Well, research has shown there are stem cells in your blood. They're called very small embryonic-like stem cells that are dormant, which may be able to be woken up with certain frequencies of laser, and they're your own stem cells. Umbilical cord blood. Well, if you're going to have that done, you have to do HLA matching, and they better be the same blood type. Bone marrow stem cells is FDA approved for leukemia and blood cancers. Adipose stem cells, that's when stem cells taken from your own fat, so it's your own. Then we have Wharton's jelly. That's from the umbilical cord after the baby's born. They're not aborted fetuses, it's afterbirth tissue. The problem is the FDA has banned a lot of these therapies. You cannot culturally expand or grow stem cells if you need a high amount, so you have to go overseas. Jack Nicklaus had to went to Germany to have expanded stem cells to cure his back pain. So what can we do in the US? Well, we're working on a lot of IRB studies. One is going to be with the NFL Alumni Association to treat chronic arthritis and spinal pain. I've had many meetings with the FDA director of CBER, this is in Washington, to get the latest guidelines on stem cell therapies. There are two pathways. One, you do a 351 investigational new drug study. Don't do it, takes 15 years, millions of dollars, won't be improved. 361 pathway is what we take. As long as the tissue is homologous, no systemic effect, and minimally manipulated. What does homologous mean? Same structure and function, same structure and function of the recipient. Wharton's jelly is like a cushion. That's the cord of the umbilical cord. It's like a jelly. It's called Wharton's jelly. It provides cushioning the umbilical cord, artery, and vein. Under electron microscope, the gray is the collagenous characteristics of Wharton's jelly. They're like collagenous fibers. The right is knee cartilage. You can see it's homologous tissue. It repairs the tears in the meniscus. This is a real patient. Before, the circle shows a bone-on-bone knee, stage 4 osteoarthritis. 88-year-old patient female, needs 2 knee replacements. After the Wharton's jelly injection with laser signaling, you can clearly see the meniscus has been regenerated. She's walking without pain. She does not need the knee replacement. There was a study done on a group of rats with laser signaling, basically for 3 weeks. Group A rats, they had the fake laser. Group B rats did the real one. The control, no regenerated cartilage. The rats with the real laser, regeneration of cartilage. We've seen this in L5S1 bone-on-bone spine disorders, regeneration of the disc tissue. 80% of the population will have back pain at some time in their life. Great alternative to spinal surgeries. Light, we need it for regeneration of vegetation, your bones, vitamin D, 125 cholecalciferol, and then light signals your bile circadian rhythm, and it signals your pineal gland to release melatonin. That's how your body heals, its signals. We can manipulate the signaling pathways, the healing pathways, light and lasers. Different frequencies of lasers or red light can heal the body. Because the mitochondria, the powerhouse of your cell, needs ATP energy to regenerate tissue. We can scan your inflammation, which is the cause of every disease, with infrared thermography. This patient had leg pain and knee pain. The white is inflammation and lack of blood flow. 3 months after the laser cell signaling, restoration of circulation, no inflammation in the knees, he's walking without pain. So not only would you diagnose with laser and light, we also treat with laser and light. I don't have time to talk about the other applications, but I can say, basically from head to toe, any type of neuromusculoskeletal disorder may be signaled to heal with certain frequencies of light and laser. The problem is the older you get, your endogenous, your body's stem cell count goes down. The cell goes under senescence with cell death. It's not as reparative. So sometimes you need to have the Wharton's jelly injected in to replenish those numbers, along with the light to signal the tissue to grow. If you have or know somebody with any of these disorders, and you like more clinical studies about the effects of how this could be treated, I am just about ready to publish my new book. This is probably going to be the cover. I'm almost done with that. But if you'd like a free PDF unabridged copy, text me what disorder you or your friend has to this number, and I'll send you the book and information on that disorder. And as Dr. Spock said in Star Trek, live long and prosper.